This is CGTN, China Global Television Network.
Thanks to advancements in modern science and medicine, maternal and child health continues to improve and related mortalities are on the decline. But in sub-Saharan Africa, most countries still face an uphill battle to improve in this area. Currently, about 50% of the world's maternal and under 5 deaths take place in the region. This week on Talk Africa, we look at some of the key issues facing maternal and child health in sub-Saharan Africa and what's being done to overcome these challenges. I am Liu Feifei. Welcome to Talk Africa. We had the opportunity to sit down recently with Ma Yili, renowned Chinese actress and UNICEF ambassador who just visited Kenya, to get her thoughts on maternal and child health in Africa. Let's take a look.
Thank you so much for joining us on Talk Africa. Now, you have been a UNICEF ambassador for children since 2015. 4 years down the line, give us a sense of what the crux of your work has been and the message that you've been trying to promote.
我们一开始合作的项目就是关于母乳喂养的项目。
We started our cooperation on a program to advocate for breastfeeding. That's why we've been committing ourselves to promoting maternal and child health and early childhood development. I have seen similar projects here in Kenya on early childhood development and promoting breastfeeding. My message to the general public is that we should do more to raise public awareness on maternal and child health, and I hope everyone can work together to support breastfeeding mothers.
让全社会共同来支持妈妈进行一个母乳喂养。
Now let's take a quick look at your inaugural trip to Africa. Give us a run-through of where you've been so far and what you've seen on this trip.
然后也看了很多的社区。
In Nairobi, I visited 2 hospitals and a couple of community health centers supported by UNICEF. We then went to Kisumu County and Kakamega County and paid visits to local health centers and met many volunteers and beneficiary households there. This gave us a full picture of the achievements made in projects in Africa. For instance, thanks to the joint efforts of UNICEF and local health authorities, the breastfeeding rate at one project site in Kisumu County has risen sharply from 10% to over 60%. This is admirable because the breastfeeding rate in China is lower. We've witnessed very effective work and remarkable achievements.
What sort of change do you hope to see coming out of this visit?
In fact, the biggest changes that I hope to see are the increase in breastfeeding rates, which I mentioned just now, and the decline in neonatal mortality. According to my knowledge, nearly 7,000 newborns die every day across the world, 40% of whom are in sub-Saharan Africa. The data in Kisumu and Kakamega has shown a decline in neonatal mortality, though not by a large margin. I think this is indeed promising and would like to see a continued decline.
As we close, are there any other areas you believe we need to explore further in terms of the welfare of mothers and children, both in the workplace and in communities like the ones you visited here in Africa as well?
We
need to see change in funding, equipment, personnel, and most importantly, people's perceptions. I hope that every child, whether a boy or a girl, can have access to quality education so that they can improve their living conditions by themselves. Because I think a well-educated mother knows how to stay healthy and thus can help her fetus develop well during pregnancy. This means newborns are less likely to have low birth weights or unhealthy conditions, and neonatal mortality can also be reduced. Besides, a healthy mother can better raise her child.
养育他的孩子。
Joining me now to discuss maternal and child health in Africa is Khadija Abdallah, a maternal and newborn health specialist at UNICEF Kenya. She has more than 20 years of experience implementing health programs across Kenya. We're also joined by Joanne Emo, a senior health coordinator at Save the Children. Joanne is also providing technical support to Kenya's National Ministry of Health. Welcome, ladies, to Talk Africa. Khadija, what we just saw in that clip, that was Ma Yili, a famous Chinese actress and also a UNICEF ambassador, and she was here visiting Africa recently. Can you please tell us more about her trip?
Yeah, the purpose of our UNICEF ambassador during the visit was a follow-up of a potential cooperation that UNICEF has with the China in the China-Africa initiative, where maternal and newborn health is a key initiative that is going to be supported. So she came here to see how UNICEF implements its programs. So she saw our programs at different levels in the community, at health facility, and even the different contexts, the agrarian in Kisumu, the informal settlement here in Nairobi, and she also saw some of the maternal and newborn services that we support at referral levels.
Now, Joanne, in your opinion, some of the key messages that Ma Yili had put out there, which I think was to improve public awareness, to improve breastfeeding, and also education for expecting mothers, how do they relate to Africa?
We cannot overemphasize the importance of breastfeeding for mothers and especially the first 6 months of delivery of a live child. It's very, very important. So this resonates well, and this is a current situation in Africa. We're empowering mothers to breastfeed their babies as soon as they deliver, and exclusively until 6 months, because of the benefits that come with breast milk. It cannot be replaced by any other fluid for the baby. Education for antenatal mothers is very, very important, because they need to know the process of pregnancy and be prepared for pregnancy and delivery. So that information to mothers is also a very key element of maternal health.
Now, but the reality is, even though globally the under 5 child mortality rate has decreased significantly by 50% since 1990, if I'm correct, in 2016 alone, 5.6 million children under the age of 5 died from preventable causes, and 50% of that actually took place here in sub-Saharan Africa. What are the causes of these under 5 child mortalities?
Leading causes are pneumonia, complications of prematurity, malaria, HIV, and diarrheal diseases. These are the leading causes of mortality under 5. But it's also worth noting that close to almost 45% of under 5 mortality occurs in the first month of life. So a lot of deaths occur in the neonatal period, the first 1 month of life.
And a lot of these deaths of the newborns are also related to maternal health, is that right?
Yes. So majority of the deaths, as Joanne said, will occur around the time of delivery. In fact, 50% of the newborn deaths occur within an hour after they were delivered. So most of the interventions that need to be done are usually focusing around the time of delivery, because if you target that, then you'll be able to reduce a significant number of newborn mortality.
And as I understand it, a lot of the newborn mortalities are also due to preterm births, right? So in fact, maternal health is intertwined with under 5 child mortalities. And in this area, in terms of maternal health, globally, again, the numbers are improving. But in sub-Saharan Africa, hundreds of women, I believe it's about 400 women each day, are still dying from preventable causes. What are they?
The causes of maternal mortality are known, very clear. Majority of the women in Africa are dying from bleeding during delivery. They're dying from sepsis infection, and they're dying from hypertensive diseases of pregnancy. The interventions to treat are known. I think the biggest problem around maternal mortality is lack of a robust health system to make sure that these women have access at the time and the place where the interventions are needed. So with the different topographies, access, distances to health facilities, poor quality of services in the health facilities, lack of equipment, lack of drugs, shortage of human resources, all these contribute to maternal mortality in Africa.
Do you want to add to that, Joanne?
Yeah, just to add on to what Dr. Khadija has mentioned, there's a systemic cause of maternal mortality that arises right from the household level. We describe them as the 3 delays of maternal mortality. So there's a first delay where a mother, for instance, is not empowered enough to know that probably, for instance, in cases of bleeding, a mother might be having bleeding but does not know that this is actually a danger sign to her and even to the baby. So if she does not recognize that and if she does not act immediately, then there's a likelihood that that mother's life is at stake and also the baby's life. So in our African setup, most mothers in the rural setting would have to ask for permission from their spouses or from their mother-in-laws to get services. So that is where we get our first delay. The second delay occurs where the mother wants to go to the facility, but as Dr. Khadija has mentioned, there is no transport, or the topography, the terrain that we have does not allow the mother to reach the facility as fast as they should have, or probably she does not have financial capacity to get a vehicle to take her to the hospital. So that again causes a delay. So imagine this is a mother who is bleeding and a lot of time is being wasted. By the time the mother reaches the facility, which is probably a dispensary, it does not have enough equipment to handle this emergency. So again, there comes in another delay. So by the time this mother is getting really quality care, a lot might have happened. Maybe the baby would have died, unfortunately, or even the mother's life would be lost in these 3 delays that we talk about. So those are the 3 delays that we actually try to, even as we address the issues of maternal mortality, we try to address these delays in terms of empowerment of the mothers, improving transportation and access to health facilities, but also improving service delivery, quality service delivery at the health facility level.
While even in sub-Saharan Africa, there have been tremendous improvements in both maternal and under 5 mortality rates. It seems the improvements are just not happening fast enough, and we're lagging behind the rest of the world. So I guess in the same vein of what you were saying earlier, are there specific cultural reasons that's contributing to this environment in Africa?
Africa is a very diverse continent. We have quite a lot of cultural differences, and culture has really affected both positively and negatively. But from the negative perspective, we have cultures that really prohibit women from delivering in the health facility, for instance. So as an African woman, you're expected to deliver on your own for you to be seen to be strong. So once you go to a health facility, then you're not seen to be strong. So women, because they want to stand out as strong women in the society or in the community, they would want to deliver at home. So that's why you find in other African countries, delivery at home or home deliveries are very high. There are also other cultures that for instance, female genital mutilation. Kenya, Somalia, and other West African countries, this is one culture that is really one of the causes of obstructed labor. Because once the procedure is done, then a mother is not able to deliver normally until another intervention is done. So again, it really affects, or it really negates on the health of the mother. Other cultures also prevent vaccination, for instance. So you find there are mothers who cannot take their babies for vaccination because they use the home remedies or herbs to treat or feel that they protect their children using such herbs and not necessarily conventional or antigens or vaccinations in this case.
Thank you. We're going to take a short break now. The conversation on improving maternal and newborn health continues when we come back. Stay tuned.
China Global Television Network. From broadcast centers in Beijing, Washington, and Nairobi. A unique global perspective. 6 channels and a video content service. News when you want it and where you want it. On TV screens, websites, mobile platforms, and social media. CGTN. See the difference.
You're watching breaking news on CGTN.
Welcome to the world today on CGTN.
Welcome back to Talk Africa. My expert guests are still with me. We have Khadija Abdallah, maternal and newborn health specialist at UNICEF Kenya, and Joanne Imo, senior health coordinator at Save the Children. Khadija, one of the new initiatives that's been launched by UNICEF is Every Child Alive. Please tell us more about this initiative.
The Every Child Alive is an initiative under the umbrella of Every Woman, Every Child, which supports the Sustainable Development Goals. Now, this is an initiative that appeals to governments, it appeals to businesses, to communities, to individuals, to make sure no child is left behind, to make sure that every child has access to quality health services, every child has access to clean water, and every child has access to good nutrition. And mainly it is targeting newborns. You find globally you have 2.1 million deaths occurring for children who are below 1 month of age. And most of these deaths occur again in sub-Saharan Africa. And 80% of them are preventable.
Now, it's interesting. I went online and I looked at the pledge, and I signed the pledge. And one of the questions the pledge actually asks is, why is it that the resources are not getting through to the mothers and the newborns?
The resources are there, but in terms of prioritizing the resources that will really address the real issues, I think that's where we lose it out. And then also we have a lot of policies and guidelines, but we sort of have not been able to really unpack these policies to reach, for instance, a service provider at the lowest level of service delivery, so that this service provider is empowered to be able to talk to the mother and take good care of the mother and teach and give health messages and treat even the children. So I think we have concentrated the resources in probably a higher level, and very little is trickling down to the mother and the lower level service provider.
And in fact, the United Nations Millennium Development Goals, number 4 and number 5, were aimed at reducing maternal and under 5 mortality rates. The goal was set for 2015, and while a lot of progress was made, many sub-Saharan African countries failed to meet the targets. Are those some of the reasons?
Yes, definitely those are some of the reasons. And now the more focus, initially the focus was on coverage of interventions, but quality was left behind. So you find quality of care now in the Sustainable Development Goal is a key thing. So you find a county like here in Kenya, in Nairobi. Nairobi has one of the highest skilled birth attendant in the health facility, but contributes very high to newborn mortality, almost doubles the national figure. And the reason behind that is mainly due to poor quality of care that is provided in the health facilities. Of course, issues of access, issues of poverty, I think is very key. That contributes to also some of the cultural practices that Joanne mentioned. Education, very closely linked to outcomes for both mothers and newborn. You have very high adolescent pregnancies. All those contribute to poor outcome, both for the mother and for the newborn. So the issues of access, the issues of quality of care, the resources, and when you look at the Every Child Alive campaign, there are the P's that have been mentioned, the people, the products, which are the commodities, availability of the services. So all those 4 P's, empowerment of the women, those are key things to address the causes of mortality, especially in Africa.
One of the things that you mentioned is prioritizing, Joanne, and in fact, the 2 countries, as far as I know, that met the Millennium Development Goals in sub-Saharan Africa are Rwanda and Eritrea, not the richest countries in this region. Why was it that they were successful?
It was about prioritization. They got their priorities right, and they put their resources. Rwanda, for instance, was able to improve coverage, national health insurance coverage, especially at the community level, up to around 97%. So you find that almost everybody is eligible to care, and those people who are not having enough resources or do not have the financial capacity cannot be left out in terms of accessing care. So those are some of the things that probably even other countries can learn from Rwanda. I would take also an example of Malawi that really scaled up kangaroo mother care during that period, and that really helped in improving the newborn health outcomes, especially due to deaths due to prematurity. So I think there are still countries that have done so well that other countries can be able to learn from.
Now, looking beyond the Millennium Development Goals, the United Nations has come out with, as you mentioned earlier, the Sustainable Development Goals, and there have been very ambitious targets set for that in this area. I believe the targets are to reduce maternal mortality to 70 per 10,000 live births, and to reduce the under 5 mortality to 25 per 1,000 live births. Are these targets realistic? Are they feasible? Can we achieve them?
Unlike the MDGs, the SDGs, I think there was a lot of consultation between the low-income countries, the middle-income countries, and the high-income. The MDGs, the focus was mainly with the high-income, the setting of the targets. The fact that countries were involved, and there's been a lot of consultation in even developing those targets, it means that there is possibility. With proper commitment, with proper governance, it is possible for us to reach. The only problem is, right now countries are different levels. You have countries who have maternal mortality over 1,000. Now for them to achieve a level of 70, and which it's been agreed for countries that have over 400 maternal mortality per 100,000 live births, for them, I think the target goes beyond. So they go up to 140. But even with that, it means you need to be consistent, and the rate of reduction needs to be significantly very high. The good thing about Sustainable Development Goals, again, is the universality, and also for sustainable, this time there is less reliance on donor funds. We know the funding from the donors are reducing. So there is more on the government commitments, local resources to ensure sustainability. So with all that and the commitment that are coming out from governments, it is possible. to reduce.
And of course, the Sustainable Development Goals as a policy framework also dovetails with the AU Agenda 2063, and also probably to a large extent, for example, at national levels in Kenya for the Big Four agenda items here as well. What are some of the synergies that comes out of these overarching policy frameworks?
Yeah, if you look at maternal health and you look at newborn health, most of the causes are outside health. Things like nutrition, which is so reliant on agriculture. Things like clean water, which is outside health. Things like peacekeeping, outside health. Road infrastructure is outside. All these things are dependent for us to be able to deliver health services to the mother and to the child. When you look at all these other policies, the AU Agenda 2063, it is talking about all these other developments, talking about trade, it's talking about poverty reduction, it's talking about agriculture, it is talking about, so all these will definitely have a big impact on the outcome for mothers and children in the overall. It will help, it will support the delays that Joanne talked about, the road networks, the lack of food, the poverty, education, all these things will be addressed with all these other initiatives under the AU, which will definitely have a huge impact.
Now, we have time only for one last question. We've been talking about these policies and frameworks. Let's bring it down to the basics. In your expert opinions, what are some of the practical, actionable things that we can do now to prevent these preventable deaths? Hundreds for mothers and expecting mothers, and thousands for the under 5-year-olds in Africa today. What can we do now?
Maternal mortality and child mortality, the causes have been there. The solutions, we all know them. What has been the problem is we have not made deliberate efforts to address these issues. So what, in my opinion, what I would recommend is that, of course, increase in resource allocation would come in very handy, but also prioritizing, especially strengthening the community health service delivery, so that we have a lot of issues being handled at the community and lower level, and then we can sieve and just have very complicated cases that will go to the upper or higher level facilities. So in that way, you'll decongest and use very little resources, or it's very cost effective because you'll use very little resources at the community level, but to achieve much more than compared with what we are doing currently, where we are trying to really do everything at the same time, but we are leaving out the basics in terms of reaching the mothers and the babies.
And Khadija, what are your thoughts?
For me, I think we need to use evidence and get very simple technologies, very cheap, cost-effective, high-impact interventions, and scale it, because evidence has shown with those interventions that are cheap, not expensive, especially for resource-limited countries like sub-Saharan Africa, if they are implemented to scale, we should be able to achieve our set targets, both at national, regional, and global level.
Thank you very much. And that's all we have time for on this edition of Talk Africa. A big thank you to our guests, Khadija Abdallah, a maternal and newborn health specialist at UNICEF Kenya, and Joanne Emo, Senior Health Coordinator at Save the Children. Remember, you can be a part of this conversation online through Facebook, Twitter, and YouTube. And do join us again next week for more of Talk Africa. From me, Liu Feifei, and the team here in Nairobi, until next time, goodbye.